Hello, welcome back to another Mammography Registry review lesson. In this lesson, we are going to talk about special procedures part 2. So if you have not seen part 1, I will try to remember to attach it at the end of the video so that you can click on it, or I will remember to just put the entire playlist in my description box. So always check the description box. I had someone who commented under the video that I made yesterday, and they requested for me to make this one because I already have part 1, but they wanted me to make part 2. So if you have any type of request that I have not already done yet, feel free to comment below. So I always like to put the exams content specification just in case someone is new and they're seeing this video for the first time and they haven't been able to see my other videos where I have this information. So pretty much I have my license through ARRT, so I'm following their content specification for the exam. However, you can use this for any mammography registry that you are taking, whether you're in another country, you're in another state. This right here is just universal and you can use it for any national board. But for this particular lesson, we're going to focus on the procedures, which will be the majority of the test. But under the mammography positioning and procedure section, there will be about 39. So we'll just dive into this section. For my Q&A, I like to read the questions, the answers, and give the explanation after I give you a little bit of time to think about the answer. I do this because people are watching my videos in the car while they're cleaning up. I've received comments where people say, they put me, they listen to me while they're doing things in the background. So that's one reason why I do it. Another reason why I do it is because it takes me a lot of time to make these videos. I'm not just copying from a book. I'm doing this through research, through experience. I passed my registry on the first try. So that's why I also like to just put me in there and my voice. So that's why I always just read it or whatever. But other than that, we'll get on with the questions. For question 11, this is question 11 because if you go back to part 1, I start from 1 and end at 10. So for part 1, that's 1 through 10. So for question 11, which procedure is performed on women that has no symptoms of breast cancer? Is it breast MRI, diagnostic mammogram, screening mammogram, or stereotactic biopsy? Okay, the correct answer is screening mammogram. So this is routinely performed on women who have no symptoms at all. And whenever patients do come in and they say they have a lump on their breast, you cannot perform this under a screening mammogram. They have to have a diagnostic mammogram. They may talk you into just doing it under a screening mammogram, but as a new tech, if you're unsure, you need to go grab the manager or ask the radiologist. But you cannot perform a screening mammogram on someone who has symptoms or a lump. um, for your breast MRI, that is normally done when patients have a history of breast cancer, was diagnosed with breast cancer, have implants that they are trying to see if there are like any ruptures or anything, if they have problems with their implants, if they have dense breast tissue, if they've gotten their genetic mutation test back and it's positive, and so they're high risk for breast cancer, so they do the breast MRI. So that's whenever breast MRI is ordered. For the stereotactic biopsy, that's ordered whenever calcifications are found, microcalcifications are found, and is that area looks suspicious, or the radiologist just want to make sure that it doesn't turn into breast cancer or it's not breast cancer. So that's whenever a stereotactic is done. For question 12, which procedure is performed to detect breast cancer in women that has symptoms for a concern? Is it computed tomography or a CT scan, diagnostic mammogram, screening breast ultrasound, or screening mammogram? The correct answer is a diagnostic mammogram. This is performed in women that have symptoms for breast cancer or concerns such as that lump I was telling you about. Now check with your facility radiologist manager on this one because some clinics will turn patients away on a screening mammogram if they have consistent pain in a focal area, meaning in one particular area. Some places will not turn the patient away if they have like bilateral breast pain because it could be hormonal, they could be under stress, caffeine. So I always say check with your facility. I float a lot to different facilities. One facility I went to, the radiologist was like, let's do it, let's do it. They're this and that age and it could be hormonal, they saying it's coming and going, things like that. But I'll go to another place and they say, okay, breast pain, let's reschedule them. So I always just check with your facility on these different policies because, it's medical. With medical, things changes all the time. And then, with your screening mammogram, this is routine that is performed on women who does not have any symptoms at all. They're just coming in because it's preventative. For question 13, a microscopic examination of the cell samples are called breast MRI, cytological analysis, histological analysis, or stereotactic biopsy. And one thing, if I'm going too fast, you can pause the video or rewind it. Question 13 answer is cytological analysis. So, cytological analysis and histological analysis is two terms that is easy to get confused. So, on my videos, I always read the explanation as well, but I do have an entire review lesson on this. But a cytological analysis is a microscopic examination of the cell samples. I always remember this because cytological start with a C. Cell samples, cells start with a C. So that was the easier way for me to remember that. So maybe you can too. And then you have a microscopic examination of tissue samples are called histological analysis. So those two terms are always confusing, so just make sure that you know. For question 14, a specimen radiograph is what? Is it the breast implant that is surgically placed, breast implant that is surgically removed, breast tissue that is imaged during a screening mammogram, breast tissue that is removed during a biopsy? Breast tissue that is removed during a biopsy. So a specimen radiograph, which you can see it right above me, that is how the image look. It is the breast tissue that is removed during a biopsy procedure. A specimen radiograph is done to confirm that a lesion was removed. It is to ensure that the surgeon was able to get all of the required margins, they call it, and to make sure that it is clean. So whenever they are looking at this, they're just making sure that that lesion or calcification that they was biopsying is, in that picture. That's why they're taking the specimen radiograph. It is very timely normally whenever the someone come in, like someone from lab, I'm not sure exactly where they are from, but they'll come in with the specimen in like a round jar or something. Then they'll ask you to take a picture. So that's what that is. So If you all do not mind, could you please leave me a comment? If you made this far in the video, we'll pick up with the question in just a second. But I wanted to just know where you all are from. I'm just curious, because I'm from, the United States, but I'm just curious if someone is watching my videos from Canada, Africa, uh, Paris, just to see where everyone is watching for, where watching from. So if you don't mind, could you comment below and say I'm watching from, and then say your state. So I'm watching from California. I'm watching from Minnesota. I'm watching from New York. I'm just trying to get an idea of like if there are a lot of mammotechs, coming out, want to start mammo, or if it's like something where too many people aren't joining. So that's why I'm curious just to see where you all are watching from, just to see if your state has a lot of jobs available for mammography techs. Okay, back to the questions. Question 15. Which procedure is performed on non-palpable lesions or calcifications if the stereotactic technology is unavailable to use? Is it breast MRI biopsy, diagnostic mammogram, ductography, or preoperative needle localization? Preoperative needle localization, also called your needle loc. So this is performed on non-palpable lesions or calcifications, meaning non-palpable mean the patient can't feel it, the doctor can't feel it. It probably was noticed accidentally or incidentally on their mammogram, or if they came in for an ultrasound for something. So this is non-palpable. That's what that means. So it is important to know that this procedure is done before a surgical excisional biopsy. A breast MRI biopsy is performed only if a lesion was seen the best on a breast MRI scan. So just keep that in mind. Ductography is performed to examine the milk ducts within the breast. So that's information that you should know, important information. For question 16, which biopsy is the most commonly performed because of its minimally invasive technique? Core biopsy, fine needle aspiration biopsy, preoperative needle localization, or stereotactic biopsy? Core biopsy. This is the most commonly performed procedure and it uses a minimally invasive technique. It is inexpensive, easy to perform, and results in highly accurate results for the lesion that is being biopsied. All right, just another quick thing I wanted you all to let me know. So, could you let me know in the comment box under my video when you are taking your test? Do you need me to post any more studying material? I do have a playlist where I have a good amount of videos, especially the ones that are like an hour long. Those are like the review lesson, kind of like the lesson you would buy if you was Googling, you know, Mammography Registry seminar. So that's what those 1 hour videos are. It's pretty much like a seminar for you. So shout out to these ladies who did comment under my videos. They told me to keep posting. They let me know when their exam was. You have Ash Matum, sorry if I mispronounce your name. I always see this name. They're always supportive as well and giving the video a thumbs up, telling me that they was waiting on a certain video, that they enjoyed it. Shout out to Elizabeth. I did post the video that's up there in the purple looking color, kind of like right above me. I posted that video yesterday, and that person, Elizabeth, commented and said, "Hey, thank you for your videos. We appreciate it. I'm taking my test she told me when she was taking her test. She said, I think it was like it's some time in July. I'm taking my test because you make more review questions on this. So this is why I made part two of the procedures because she asked me for more. For image production, if you watch this, Elizabeth, can you let me know if you saw that I have two physics videos already in my playlist? So anyway, I'm more than likely to get out a video quicker if I see that I'm helping you all. If I see that you're thumbing up the video saying that I'm helping you, or if you're commenting, appreciating, or saying that you want a different kind or you want more. Because it is time consuming to make these videos, but I'm doing it because I want you all to pass on the first try. Um, I also make other videos to help people pass. I gotta work. I'm not getting paid to do this right now. So anyway, so just you commenting is motivating me to keep posting pretty much. So anyway, I just wanted to throw that out. Thank you all for commenting and supporting the videos. And even if you have seen all of my other videos and you're good on the material, what I have is just, good enough for you, just still let me know when your test date is. Also, if you don't mind, can you come back to the video and just let me know how you did on your registry? I'll show y'all at the end that some ladies had commented and told me, hey, we did this or I passed this. So anyway, back to the question. I just wanted to throw that out. Question 17. Which procedure only removes fluid and cells? Is it fine needle aspiration biopsy, core biopsy, histological analysis, stereotactic biopsy? So this procedure is only going to remove the fluid and cells. The correct answer is fine needle aspiration biopsy. This is going to remove only the fluid and cells, and a core biopsy will remove a sample of the breast tissue. So core biopsies remove breast tissue samples. The fine needle aspiration biopsy removes only the fluid and the cells. For question 18, which biopsy procedure is an 11 to 14 gauge needle or larger that is used to obtain tissue samples from core biopsy, cyst aspiration, diagnostic mammogram, or fine needle aspiration biopsy? Okay, the answer is a core biopsy. This is going to use the 11 to 14 gauge needle or larger to obtain those tissue samples from a core biopsy. A fine needle aspiration biopsy uses a 21 to 25 gauge needle size. For question 19, which imaging modality is the primary tool at visualizing breast calcifications? Breast MRI, breast ultrasound biopsy, or mammography? Mammography is the correct answer. This is the primary imaging modality for imaging calcifications within the breast. Breast calcifications will appear as an artifact and a streak on breast ultrasound images. So, whenever you start working routinely under the diagnostic mammo side, because depending on where you work, I think people rotate or so whenever you start doing diagnostic mammograms and a patient is called back from something seen on their screening mammogram, if it's for microcalcifications, you may see that the facility put in a diagnostic mammogram order with a breast ultrasound. The breast ultrasound is never done for calcifications because it's going to streak on the image. Now, if the patient have like another area, let's just say like a lung, and the calcification so happen to be in that area, then Of course, you can see it in an ultrasound, but in a breast ultrasound is not done specifically to look at or follow up on calcs or microcalcifications. For question 20, the main reason for a breast clip placement is to place in a biopsy site before surgery is performed, to identify a site that has already been biopsied and determined benign, to identify a site that is malignant for breast cancer, to use for patients that are high risk for breast cancer. Okay, the correct answer is to identify a site that has already been biopsied and determined benign. A clip is placed in the breast after a site in the breast has been looked at, removed, and determined um, as a benign area. The biopsy clip provides a landmark. It states that the site has already been looked at and confirmed as a benign lesion. This stays inside of the patient's breast unless it has to be surgically removed due to breast cancer. So if a patient does have a clip in their breast, they can get an MRI scan. I work in MRI as well, and I do a lot of breast MRIs. That's one reason why I actually got into mammography after I was an MRI tech, because patients kept coming in with a clip in their breast made out of titanium, but I didn't know if it was MRI safe or not. So I would always just research this, and I was like, I want to do mammography because I don't know much about why these patients are coming in. So that's one reason why I got into mammography. Okay, so that's it for the questions. Just a quick review of information that I did not want you all to forget. You can find more of this information in my anatomy video that I have. That's an hour long. That's pretty much is your free seminar. So I would just take advantage of it. It has a lot of information in it. I always tell people, do not just focus on the questions and answers. Read the lesson first, then review the question and answers, because that only give you like a segment, what you need to know. You also should watch the review lessons as well. Okay, so for the treatments, just keep in mind you have tamoxifen. This is used to shrink large tumors. Is recommended for 5 years as a single therapy. You have raloxifene is a substitute for tamoxifen. Chemotherapy and adjuvant therapy that involves using drugs to treat cancer that has spread beyond the breast tissue. So the chemotherapy is going to just pretty much just it's like a treatment that's just treating pretty much the entire body because that cancer has spread. So radiation therapy, this is used to treat breast cancer with high energy radiation to destroy cancer cells that are located in the chest wall, axilla or your axilla, and the breast tissue. So radiation therapy is going to target a certain area um, that has the breast cancer. For brachytherapy, this is radiation that is applied from inside out. Your mastectomy, the surgical removal of the entire breast tissue. Prophylactic mastectomy is the removal of healthy tissue, healthy breast tissue for individuals that are at a higher risk for breast cancer. So for the prophylactic mastectomy, sometimes if these patients, they had that genetic mutation test done, the BRCA gene, and they found out that they was either positive for that or checked too. And then you also have that they may have seen like a family member go through breast cancer, and maybe it runs in their family, or maybe someone close to them had it, such as their mom or the sister, and it's passing down to the other sister. Or for these reasons, they're like, I've seen it before. I don't want to suffer. I don't want to bear risk. Let me just have my breast removed. So that's what that is for. For your lumpectomy, this is the removal of malignant tumor, which involves the margins that is around the normal breast tissue area. This can be done with radiation therapy and or chemotherapy. So this is just a highlight of pretty much what is already in that anatomy video that I was telling you about. So I just didn't want you to forget these important terms. So that's it for this video. Thank you all for watching. Please leave a comment below if you found this video helpful. Also leave a comment, especially whenever you get done. Just go back to one of my mammo videos and share that if you pass or when you're taking your test. Shout out to these ladies that took their test and passed either in June of 2025 or May of 2025. So it was very recently compared to when this video was made. So if you found that this video is helpful, could you please give it a thumbs up, and also feel free to like, share, and subscribe to the video, and also subscribe for more information, because you can use this if you are going through ARRT. You can use this also in 10 years to help you prepare for your CQR exam. But other than that, thank y'all for watching. I made this video kind of like the day after I made that other biopsy video, because someone commented below and they wanted another video. So thank y'all for watching. Thank y'all for commenting. Bye.